Well, regular based medicine is going to say you have an infection, here's your drug to kill it. Whereas functional medicine is going to say, well, you keep getting these herpes, cold sores outbreak. What is going on in your life that's making your immune system weak and susceptible? So functional medicine at the end of the day is a root cause to say, what is the underlying process? So let's use headaches as an example. You go to a traditional medical provider, you tell them you have headaches. They're usually going to say, okay, well, have you taken ibuprofen? Have you taken Tylenol? Yes or no? Well, then do this. A functional medicine provider is going to say, well, what are things that contribute to headaches? How's your sleep? How's your posture? How's your blood pressure? How's your blood sugar, right? How's your nutrition? How's your exercise? How's your weight? They're going to go through a lot of those factors to decide which ones are working for you and which ones aren't. So it's all about identifying what is driving a process and to stop what's driving it versus traditional medicine, unfortunately, is more based upon saying, well, we don't really care about what's driving the process, even though it's really sad because the researchers have done a beautiful job of researching a lot of this. And people often say, like, well, I don't know, functional medicine, it just seems weird. Well, we take the underlying processes that go in the body and we say, what's driving this? Versus, once again, traditional medicine is saying, where's the end point? So there's a big philosophical difference, even though we can study the same research, but the point we take to use is different. Now, there are differences from one functional medicine provider to the next that I'm going to briefly cover. So I've got what I call the 4 different types of functional medicine providers. Number 1, this is the functional medicine marketer. Functional medicine has become a lot more popular over the past few years. And individuals are putting on their website, putting on their business cards, or even on their signs that they are a functional medicine provider. While that's true for some, others, they don't do any functional medicine. Maybe they do weight loss meds. They don't think taking supplements is a waste of money. They think nutrition is important, but they don't go in depth with any labs. They don't really understand the processes, but, they do like the concept. And so that's what I call the functional medicine marketer. Number 2, this is the functional medicine dabbler. They've went a little bit further. They're excited. They've signed up for some courses through places to learn about what these processes are. They're doing a little bit more lab. So you're getting your vitamin D. You're probably getting high sensitivity C-reactive protein. You may be getting a more expanded thyroid panel just beyond a TSH and a T4. But they don't really understand it in depth. They don't have a lot of true experience. They do some basic supplements, but they kind of just give everyone the same basic things because they're just, they're learning, they're excited. And that's where they're at. Number 3, this is what I call the functional medicine extremists. These are the people who, when you walk in their office, you're guaranteed to spend $2,000 to $4,000 in labs. Every single person who comes in, they're going to do the same labs on everyone. This isn't the same initial $300 worth of labs to get a good initial picture and then decide how to progress from there. No, these are the people who say, I went to courses and I think a lot of the stuff is cool. So let's run urine heavy metal, urine mold, urine environmental toxin. Let's run stool testing, urinary hormones, right? They're going the gamut and they're running everything. And then when people get treated, they're trying to treat it all at once. And people ultimately come in on 20 bottles of supplements. Some of them have done okay, but obviously if they're coming in and seeing me, they have not done okay and they are on overkill and they are on burnout. And then lastly, number 4, this is the functional medicine expert or the ninja. This is the individual who's been in functional medicine for a bit. And they understand that functional medicine is about understanding the underlying root causes. They also understand the importance of a evaluation and history. When you're talking to them in their mind, they're already piecing together the pieces of your puzzle. That way, whenever they make lab recommendations, they're going to make it as targeted for you as possible. So you may get mold testing, or you may get infection testing, or you may get a stool test.